Fort Drum, New York teammates, good afternoon and welcome back to the Mountain Medic Podcast. I am Mountain Medic 6, Colonel Christina Buckner, and this is
Mountain Medic 7, Command Sergeant Major Frederick Gibbons.
And today we're coming to you with a big topic, a big and very important topic that you may have heard hit the streets already. So Battle, as you know, the medical system, we like to evolve and adapt to our patient needs and demands. And most recently, the Defense Health Agency has set us on a path towards the accelerated care transformation model, where we are now focused on value-based care, which is patient-centered. So what does that mean for our patient population here? A couple of things. It helps us to increase access to care, which is the most important thing for our patient population that we support, as we understand that medical care really factors into quality of life. We, behind the scenes, are going to look at population health, patient demands, really understand how we can apply resources from our most sick population to those that just require routine treatment. Battle, how are we going to solicit input from our patient population?
Ma'am, I'm glad you asked. So teammates, we will solicit your input through different QR codes that will be located throughout the facility. We will also use our social media platforms. So if you're not following us, please follow us on Facebook, IG, and we will also send out surveys. So please give us your feedback so that we can better serve you in the Fort Drum community. We're waiting to hear from you.
Thank you, Battle, for that. You know, these surveys are very important because in any great relationship, we need to make sure that our patients are seen, heard, and understood, and that we can take your critical feedback and apply them to the practices of Guthrie. Because there's three things that we want to improve for our three critical populations. One, the service members, which we always have to ensure their readiness. Two, the family members, ensuring their readiness and resilience to ensure that they're providing optimal support to the service members fighting here and also downrange. And then also our retirees, health prevention and great outcomes for sustainment of life long term. So we plan to do that by improving our systems, and also we'll keep you informed of those projects as we're moving forward. I do want to talk about something important that's come up quite often, Battle, the phone lines.
The phone lines.
The phone lines.
We hear about it often.
And we see your messages. Now, what we have done is we have increased the phone numbers. So patients can now call in to our primary care clinics as well as our Surgery Health Services clinics to make appointments, in addition to using the 888 number that is the call center. Understand, though, that we do have volume issues because I think we receive the largest volume of calls here on Fort Drum. So with that said, as we are working with our technical experts to implement something called Cisco Unity that allows us to flow those calls in a streamlined manner, also allows you to connect to the right clinic, and then also allows you to leave a message so that providers can call you back to either address your concern or schedule your appointment. Battle, any feedback?
You know what else it does? It will play music in the background.
Yeah, we like music.
It'll play music so you don't think you're hung up on or you just left out in the dark. It will play music for you so that you know you are still important to us and that you're still on hold. There is another system called T-Metric that we're also working in the background as well. So listen, we're hearing your feedback loud and clear. There are two systems that we're working very, very hard on with our technical community, as the commander mentioned, to get better service to you all.
So remember, there are always three ways to call and make an appointment or to connect with your Guthrie team here. And that's one, the call center, which those numbers will be left for you. There's also MHS Genesis, where you can go online, send your providers a message through the provider portal so that they can engage you via the secured message center. And you can also make appointments on MHS Genesis. And third, please always come in and see us. That's sometimes the easiest and fastest way, especially if you're on post or live close to Fort Drum.
And please, education is huge, and it's our number one concern with you all. The Genesis system we know can be very complex at times, but we have leaders here who are very proficient in the use of the Genesis system. So we're here to educate you. So any concerns, please reach out to us and we will educate you on how to use the system.
All right. So for today, that's all we have, but we will keep you updated on what accelerated care transformation means for you as the patient. And we hope that you, over time, can see that all of our improvements are increasing access to care and better outcomes for your health. Please remain engaged and be active participants in the delivery of your own health care here in the North Country. Thank you. And as always, Mountain Medics,
Care for the climb.
have a good one.